I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, we are going to talk about how should a diabetic couple gear themselves up for IVF. Now, we know that around 5% of couples are both diabetics, husband and wife, or many a times because of the changed environment, lifestyle, lack of exercise, too much of sugary foods in the diet, we have noted that around 40% of the infertile couples suffer from high sugar levels or diabetes mellitus. Now, there are two types of diabetic patients. One who have acquired it from their parents, who have it right from birth, or type 1 diabetes or familial diabetes. And the second one, which is the commonest now in infertility, is the type 2 diabetes. This type 2 diabetes is not present since birth, but it is acquired later because of excessive weight gain or diseases like PCOD, coexistent hypertension, hypothyroidism, lack of exercise, too much of weight of a patient, etc., might cause the insulin resistance. Now, suppose a couple comes to me saying they want to go ahead for IVF. The first and the foremost, this has to be a teamwork. That is, a diabetologist, the patient, her husband and IVF consultant together forms a team who will be treating this patient. So, the diabetologist is concerned with the blood glucose leveling, in which we require an HbA1c level of less than 6.5 in the husband as well as the wife to go ahead for a IVF. If the HbA1c is more than 6.5, we ask the diabetologist to adjust the doses. They use their best possible medications, and if required, insulin is used so that the HbA1c is obtained less than 6.5. Once this HbA1c is levelized, the patient may be put on certain glucose sensitizers, insulin sensitizers like metformin or myoinositol, which will maintain this balanced glucose and which will prevent any kind of diabetes being transmitted to the offspring. Even in the semen, it has been noted that excessively high HbA1c levels are responsible for less motility and poor morphology of the sperms of the husband. Apart from this, medication, insulin and all the leveling of the glucose, there is a very important role of diet, nutrition, exercise during IVF therapy as well as during pregnancy for diabetic couples. So, if you are a diabetic couple, don't lose hope. It is not necessary that your diabetes will transmit to the offspring. If your sugars and HbA1cs are controlled, you still stand a very good chance of a pregnancy. If they are controlled, there are lesser chances of abortions or miscarriages or abnormal fetuses in the uterus, and thereby resulting in a healthy mother and a healthy child in a controlled diabetic couple going ahead for IVF technology. Thank you.